Okay, good afternoon. I'm Cheryl Welbeck, Project Manager for Directors of Health Promotion and Education, and welcome to today's webinar. Today's webinar is Meet the Partners, an overview of the National Implementation and Dissemination for Chronic Disease Prevention National Organizations. This is our standard disclaimer slide. It basically says that the views expressed in today's presentation are those of DHPE and SOPHE, and do not necessarily reflect the views of the U.S. Department of Health and Human Services, Centers for Disease Control, or the U.S. government. Okay, here are the learning objectives for today's presentation. Today we would like to help you all learn about the mission and vision of each of the national organizations working on this initiative, help you to gain an understanding of the differences among and between the organizations, and explore resources from each of the national organizations. This slide many of you may have already seen before. It shows the structure of the project, where funding flows from the Centers for Disease Control's Division of Community Health to two categories of national organizations. There are three Category A national organizations, all of which you all work very closely with: American Heart Association, the American Planning Association, and the National WIC Association. Category B organizations, DHPE and SOPHE, are tasked with providing support in the areas of technical assistance and training, and also communication support to all of you, the chapters and affiliates of the three Category A national organizations. The first partner that we are presenting is CDC's Division of Community Health, which of course provides funding to make all of your projects and our projects possible. DCH serves as a national leader in advancing the science and practice of community health, and currently they are running three programs, one of which is Partnership to Improve Community Health, or PITCH, which some of you may have already heard of, the REACH program, which is Racial and Ethnic Approaches to Community Health, and also the National Implementation and Dissemination for Chronic Disease Prevention Initiative, which is the program that all of us are funded on. The Division of Community Health strengthens efforts in towns, cities, and counties and tribal areas throughout the nation to help communities prevent disease and promote healthy living. The goal of these programs the goal of these community-level efforts is to make healthy living easier where people live, learn, work, and play. DCH serves as a national leader in advancing the science and practice of community health. The first national organization that we're going to start with is the National WIC Association. Of course, funding flows from CDC down to National WIC Association, and the National WIC Association, over the course of this three-year program, is working very closely with the American College of Obstetrics and Gynecology, or ACOG. They are also working with 32 local agencies, and they're using the Alterum Institute as their evaluation partner. To give an example of the types of programs that National WIC Association subrecipients and communities are working on, National WIC Association is focused primarily on initiatives that help to build bridges between community and clinical linkages. They also have programs that focus very heavily on the nutrition focus area. This slide gives an example of a very specific example of a cohort 1 community that is focused on community and clinical linkages with a focus on some cultural competency training. This is Crescent City WIC, and they promote cultural competence in the Plaquemines Parish area of Louisiana. They've been able to infuse some elements of music culture into their outreach initiative with jingles and songs to promote breastfeeding and chronic disease prevention services. They also have an organ-wise guys materials with dolls, and you can see from the top photo on your right, a couple of staff members there holding some of the dolls, representing different racial and ethnic groups. The training is offered to Crescent City WIC, the Plaquemines Medical Care, the Health Department, LSU Agricultural Center, the Plaquemines Care Center, schools and Head Start programs in partnership with Tulane University. An example of National WIC Association's efforts under the focus area of nutrition is a program that they have in Wichita Falls, Texas, which highlights healthy restaurant menu options. The program is called Por Vida, which means for life in Spanish. It was originally launched in San Antonio and then expanded to the Wichita Falls areas with the help of the Healthy Coalition of Wichita County, and then of course funded by National WIC Association's Community Partnership for Healthy Mothers and Children project. That's what the CPHMC stands for. The Por Vida program was implemented in 6 restaurants in Wichita County in September of 2015. Some of the restaurants that were included in the program are listed there in the 3rd bullet. And the Por Vida program has received a lot of local media coverage, and including some news coverage from the local channel, News 6 channel there. On the right, it shows an example of a menu for the Por Vida program. The second category A, national organization, is the American Planning Association. Of course, the American Planning Association is funded for the 3-year duration of the implementation program, with a total of $4.5 million subgranted to their 35 local coalitions. American Planning Association refers to their efforts on this particular initiative as Plan for Health, which is a larger part of the Partnering for Health, which is another name for national implementation initiative that we're working on. So subrecipients of APA are part of the Plan for Health community. The key partnership that American Planning Association has on this particular program is with the American Public Health Association, who's also leading their evaluation efforts and providing some public health expertise on the implementation program. As you know, the CDC is supporting the project and is working to reduce health disparities in communities across the country. For those of you working in health, you might be familiar with partnerships to improve health, or the Pitch and Reach programs that we talked about a little bit earlier. The Plan for Health shared vision is to help promote health equity and reduce disparities in implementation, access, and also outcomes. But the vision for the program is full integration of planning and public health where people live, work, and play. This slide shows the goals of APA and APHA's efforts on the implementation initiative, which are to increase collaboration, increase community capacity, and increase messaging. The photo at the bottom is actually a local community gardens from one of the Plan for Health projects. This slide shows a map of where the Plan for Health grantees are. The red dots on the map represent Cohort 1 sites, and the blue dots on the map represent the Cohort 2 communities funded beginning year 2 of this program. As you can see, there's some expansion into some of the western states for the year ahead. APA's Plan for Health communities are focused on 2 of the 4 focus areas. They're focused on programs under nutrition and physical activity. And under nutrition, they're working on increasing access to environments with healthy food and beverage options, and physical activity programs are to increase physical activity opportunities in communities. APA also has a peer learning network. The goal of the program, the peer learning network, is to facilitate sharing of experiences and lessons learned between the two cohorts. Also to connect external peer experts to expand and strengthen the Plan for Health community, and to contribute to multi-sectoral professionals' commitment to creating healthier communities nationwide. This slide has a snapshot of the Plan for Health website. The URL for the website is listed at the top of the screen. It's www.planforhealth.us. There it has information about focus areas and APA's specific approach to the implementation project, as well as resources for their coalitions. They've got some really interesting maps under the coalitions area. And then if you were to scroll down on the page, they also have some toolkits that are available towards the bottom of the screen. So the bottom box on the screen shows the bottom half of the screen. So they've got toolkits for comprehensive plans in health, also some on healthy community design, health and all policies, health equity, safe routes to parks, and transportation and health resources, a toolkit there as well. I'm now going to turn it over to Nicolette Warren Poe from SOPHE, who will provide an overview of Category A organization, the American Heart Association. Nicolette?
Okay, so let's look at the work that the American Heart Association is doing. Their program is referred to as ANCHOR, which stands for Accelerating National Community Health Outcomes through Reinforcing Partnership Programs. And basically their focus is focused on broadening the local expertise in supporting homegrown collaborations that are focused on clearing the air for secondhand smoke, improving access to healthy and nutritious foods, and most importantly, increasing opportunities for people, young and old, to get physically active. The ANCHOR program is focused on three major areas: tobacco use, nutrition, and physical activity. For tobacco use and exposure strategies, the program is focused on working with community residents to increase their understanding and knowledge about the benefits of tobacco and smoke-free environments, which will ultimately provide more settings that are 100% smoke-free and using smoke-free policies to support those efforts. As it relates to nutrition strategies, their goal is to focus on increasing the access to environments with healthy foods and beverage options, which includes availability and affordability of healthy foods and beverage in a variety of settings, such as workplace, prisons, senior centers, as well as child care centers, looking at government facilities, and most importantly, working with communities and community partners to create incentives for example, new grocery store developments, expanding farmers markets and community and school gardens, small store initiatives, mobile vendor carts, as well as restaurant initiatives. One of the other focus as it relates to nutrition is looking at how to promote the purchase of fruits and vegetables and other healthy foods through food assistance program incentives, such as accepting EBT payments at farmers markets. When it comes to the physical activity strategies, one of the things that this project is focused on is increasing access to physical activity opportunities, where they're working with partners to share information on how quality physical education programs can improve children's health and academic performance, as well as increasing the opportunities for physical activity in public settings, which includes improving community designs that make streets safe for pedestrians, bicyclists, and public transit users. When we look at physical activity. Some of the other strategies that they're focusing on is trying to increase the use of shared use agreements, which will ultimately improve physical activity, as well as education policies and practice, particularly in early childhood settings. So here on this slide, what you will see is 3 examples from the Anchor program that focus on 3 of the focus areas for the American Heart Association. The work that is provided here is an example of the first cohort that was funded for communities looking in Nevada, Connecticut, and Oregon. For the Douglas County in Nevada, one of their major focus was looking at how to increase indoor and outdoor smoke-free spaces, well as how to keep the Lake Tahoe blue by protecting the areas from fire and cigarette butt litter. When we look at New Haven's Connecticut Anchors program, their efforts was focused on implementing procurement policies that support healthy food financing initiatives, as well as promoting healthy farmers market initiatives to ultimately increase the access to healthy foods and beverages. For the Oregon's Kids Move with Heart, that Anchor program was focused on targeting elementary and middle school students and providing assistance to build support for a state mandate for physical education requirements that will take place in 2017. Here you can see the Anchor's webpage on the American Heart Association's website. We encourage you to visit their website to learn more about their project and individual markets, as well as looking at their affiliates and how they're working collectively to address the 3 major focus areas as it relates to tobacco use, nutrition, and physical activity. There are resources available on their website, and we ask that you consider following the Anchors program by following them in their social media outlets, as well as tweeting. So now let's transition from learning. You've learned a little bit about the category A's. Now we're going to transition to the category B's. In this case, we have the first organization is the Society for Public Health Education. So the Society for Public Health Education is also known as SOPHE, and it's an independent international professional association made up of diverse membership of health education professionals and students. SOPHE promotes healthy behaviors, healthy communities, healthy environments through its membership and a network of local chapters and numerous partnerships with other organizations. Within its primary focus on public health education, some of the things that SOPHE provides is leadership through the Code of Ethics, standards of professional preparation, research, and practice, as well as looking at professional development and how to support public outreach. SOPHE provides global leadership to the profession of health education and health promotion by stimulating research on the theories and practice of health education, supporting high-quality performance standards for the practice of health education and health promotion, providing face-to-face meetings and distance learning opportunities for professional development, and most importantly, advocating for policy and legislative affecting health education and health promotion. SOPHE Center for Online Resources and Education, also known as CORE, serves as your one-stop portal for e-learning, virtual engagement, and continuing education tracking. This integrative learning management system provides access to content for professional development, as well as career enhancement for health education and health promotion professionals. We encourage you to visit CORE to learn more about previously recorded webinars, journals of study efforts, as well as meeting webcasts and online courses. We encourage you to keep up with the cutting edge as it relates to education and visit CORE. SOPHE's partners for this project is AFIA, and they're focused on evaluation and working with 2 communications consultants, which is through Communicate Health and Stepping Stone.
Okay, this is Cheryl again. Thank you, Nicolette. I work for Directors of Health Promotion and Education, and I'll provide an overview of DHPE's programs. This slide shows DHPE's strategic focus. Our vision is to advance health policy and systems change with a health equity focus. And our mission is building on principles, practices of health promotion and education. We hope to strengthen the public health capacity and policy and systems change to improve the health of all and achieve health equity. DHPE provides a forum for our members to network and support one another. We advocate for health promotion and health equity within public health, and we provide trainings, technical assistance for states, territories, tribes, and other local health agencies and their constituents. Our programs are concentrated under two focus areas primarily, one of which is PSC training and TA. The implementation program falls under this category. We also have a systems change for health training program, which is a 5-part series. And we have school employee wellness expertise on staff, as well as a guide on our website, which is used by many worksite wellness sites and schools looking to implement programs for their employees. And our health equity programs include an internship program, a program to do analysis for community disparities. We have a variety of health equity tools and a newer program, which is a lupus education program. That program began fall of 2015. The skills-based program that I mentioned on the previous slide is divided into 5 2-day workshops which teach 21 policy competencies, which are listed on the screen there. The first of which is basically assessing and framing the policy problem. The last step in the series is evaluating policy interventions. All of these courses are 2-day workshops, very hands-on, very interactive. We also have an intro program which provides an overview of the 5-part series. 2 health equity programs that I'd like to highlight: our internship program, which has matriculated well over 500 students, serves both undergraduate and graduate students from minority-serving institutions. The internship program is a 12-week placement. The current program that we are running focuses on preventing heart disease, increasing physical activity, and promoting proper nutrition. Our LEAP program, Lupus Education and Awareness for Patients, Professionals, and Providers program, is a 1-year program funded by Office of Minority Health, or OMH. Programs that DHPE is using on the implementation program include Change Lab Solutions, which is helping us to respond to requests for technical assistance and some training needs. National Association for the Advancement of Colored People, or NAACP, and Pengood Associates, which is helping us primarily with communications activities. That concludes the formal part of today's presentation. We've provided for you an overview of the 3 Category A national organizations: American Planning Association, American Heart Association, and the National WIC Association, as well as the 2 Category B organizations, DHPE and SOPHE, which is Directors of Health Promotion and Education, and Society for Public Health Education. And of course, our funder for the implementation program, which is the Centers for Disease Control and Prevention. This program is funded under the Division of Community Health. In the handout section of the webinar, you will find a PDF document which has a list of URLs for each of these organizations. Please download that and take a moment when you have some time to visit the websites of each of the partners on the implementation program. For those of you just getting started, we wish you the best of luck with your program. If you have any questions, please contact us. You can email info@DHPE for general concerns, and staff at DHPE and SOPHE will be glad to provide assistance. Okay, if there are no questions at this time, we'd like to conclude today's webinar. We thank you for your time this afternoon. Have a great afternoon.